This is the new invasive state-of-the-art navigation system called Pulse. It uses these reflective balls and a camera system to track all our instruments during surgery. We call this spinal navigation. Very similar to how we use navigation in a car to drive, to our destination. We use these instruments to place spinal hardware with pinpoint accuracy. In this case, the camera sees my instruments, and because we already have imaging of the patient, we're able to see with this instrument where our spinal hardware, for instance, a screw, will end up once we place it. What the system allows us to do is not only place these instruments with very high accuracy, it also allows us to do this implantation using very small incisions. By using small incisions, we can do these kind of complex spinal surgeries in an outpatient center and get patients home the next day with a much faster recovery than if we were doing it in a traditional open manner in a hospital. The added benefit of the pulse navigation system is we can use something called neuromonitoring. So when we place these screws, for instance here in the spine, we can stimulate these screws to make sure that these screws are not too close to any kind of neural structures and would cause the patient to have any kind of nerve irritation following surgery. The other benefit of the pulse navigation system is once we place these screws with pinpoint accuracy, we need to connect these screws with a rod. A lot of times this is done manually, with the surgeon bending these rods during surgery to try to conform to the orientation of these screws as best as possible. In this case, however, we don't do things manually, and in an effort to keep the incision as small as possible, we're relying on the invasive pulse system to tell us exactly how to bend this rod so we can bend it with millimeter accuracy and place it into the patient in the least invasive and the most efficient manner possible, and in a way that reduces the stress on the hardware, which leads to better healing. As opposed to in traditional surgery, where surgeons use their knowledge and understanding of spinal anatomy and various X-ray images to place spinal implants, with the invasive pulse system, we use a 3D C-arm, and we get a complete and pinpoint accurate picture of the patient in 3 dimensions. This picture then allows us to place these screws with pinpoint accuracy while minimizing our incision size. This is tremendously beneficial because we can also then obtain a repeat study before the patient leaves the operating room, knowing that when the patient leaves here at disc, the spinal hardware and any implant that we place is in perfect position. This technology is typically available in large hospital systems, so it's extremely unique and groundbreaking to have this available in an outpatient surgical center, so we can perform these complex spinal surgeries for patients in an outpatient setting. What's tremendously exciting about having the pulse system in an outpatient surgery center is, unlike other navigation systems, it's like the iPhone for spinal surgery. It combines various modalities such as bending of rods, monitoring of nerves, placing of hardware, all in one platform that's easy for the surgeon to use, and in the end translates to safer, better surgery for the patient.